Well, I suppose firstly for our patients who are actually part of the pilot, and most of them have actually, well, in fact all of them that took up the offer of a personal health budget when they were recruited to the pilot, they have all actually progressed towards their health outcomes that are in their plans, or some of them have met those already. So I suppose we've got to talk about them first of all, because the impact on their lives and their health is just enormous. And I suppose the other impact has been on the health professionals that have worked with those patients, because they will all explain that the learning in this is just huge, and it's that different relationship that they now have with their patients. It's much more of a partnership, and everything's much more transparent. So they're working together, if you like, for a common goal, whereas before they perhaps didn't really feel quite so close like that. The biggest challenges are persuading people that it's a good idea, and actually it's a very complex, it doesn't sound complex when you talk about a personal health budget, a budget that covers your care, gives you choice and control. That seems really easy, but the culture shift, the behaviour change that it takes for people to do that, it cannot be underestimated. So there's huge workforce issues around this. There's also communication issues. Not only does the health professional or whoever is supporting the patient have to understand it, the patient has to understand it. In our experience, the patients understand it a lot quicker than the health professionals. And once they start writing their plans, as long as it is their plan and they own it and it's personal to them, they actually come up with health outcomes without any problem. Measurable health outcomes that we've been struggling for years to actually direct them to. So, there's all sorts of areas in this, but once you get that shift, then particularly clinicians totally understand it. The hardest group are the managers within health who don't actually have contact with patients, because it's very difficult for them to understand it. And you need case studies and things to actually show them, I think. And of course we started with a blank sheet of paper, so that was hard, persuading people that this was a good idea. Well, we haven't from the beginning. It was very difficult to actually engage GPs from the beginning, and I suppose the engagement has come with the formation of the clinical commissioning group, and I actually work within that clinical commissioning group, and before that was set up I was working in our old practice-based commissioning group, which was a very large practice-based commissioning group. I think it was one of the biggest in the country, and I was actually situated in there, so it's been a lot easier for me to influence GPs because they're in and out of the office every day. But now that we've got some evidence and we've got some case studies coming through, GPs are understanding it more, because before I was having to go to them individually and try and explain the concept, and of course they're very busy people and this wasn't a priority, particularly when they were setting up the CCG. But now that they are focusing on long-term condition management, and we know that this is going to be the area in the next few years that we've really got to work hardest on, to reduce expenditure, to make it more efficient. They are seeing personal health budgets as one of the many tools of helping this management, self-management in the community and making services much more efficient. So if you like, now the engagement with GPs is just increasing day by day as the word gets around and the case studies are shown. So it's becoming easier now, but it was really difficult at the beginning.